and this is John, Group Manager for the VNDG. So I'm getting our first piece of content out to you, which is the questionnaire, and I thought, well, it might be a good idea to just run through the questionnaire with you very quickly, just to give you an idea of how to use it if you haven't used it before. I'm sure there are some of you out there that have used the questionnaire before, in which case you probably got one, but those of you that have need of this may not have done. So it's a good thing to kind of know what you're doing when you start using it, because it's important to remember that you are using this questionnaire to gather a history of a skin case for your vet to make their diagnosis. So we aren't having to worry a great deal about necessarily finding out ourselves what's wrong with these cases through the answers to these questions. But what will happen is, over time, as you are using the questionnaire more and more, you'll start to get more of an idea of what some of the questions are asking as you go. That's how I learned anyway. I very much had the questionnaire and I just started having a go, because at the end of the day, even if you're not totally aware of some of the things that it's getting at, you are still gathering that history when that history wouldn't have been being gathered before. Otherwise, there wouldn't be need for you to be doing it in the first place. So anyway, I'll stop yabbering on and yeah, take you through it slightly. So first of all, obviously, just the main details of the pet to fill in there, and then the first page is kind of a general history of the animal. So it just gives a little bit of background. It has a derm feel in mind, but so whether it's a working show or pet animal, because that can have an effect on some of the things related to skin. How long it's been in the owner's possession, which is particularly important when you're thinking about whether it's had previous skin problems before, whether the pet was imported, which, as I'm sure you can imagine, is imported pets are always more likely to bring over random bugs and things with them. And the same applies really with overseas travel. Other in contact pets, if you go through the questionnaire with an owner, they always get a bit confused about this. Well, they always want to give you every single pet that their dog comes into contact with, or their cat comes into contact with, which might be Barney, the sister's dog, which they meet in the park every other Wednesday, and that's really not relevant. What this is getting at is pets that they're in contact with regularly, i.e. on a daily basis, because really those are the sorts of pets that can pass things across. A fleeting sniff of the bum isn't really gonna pass across any skin disease. So where do they exercise? I clarified that question a bit when I did this up for the VNDG, just because it's worth sort of clarifying with owners what you're getting at there. They may not know, but some dogs go for a walk just around the block, just on concrete, and some go into woods and long grass. I had cases who had kind of almost like a response to the kind of whipping effect of corn as they were running through a cornfield. So yeah, that's it really, is just trying to fish out where they exercise. Where do they sleep and on what bedding is quite obvious really, and very, very important when it comes to thinking about contact allergies and when you start getting into thinking about house dust mites and things like that. But I'm not going to go into too greater detail with that. That's for down the line really, and hopefully we can talk about that more later. But just to clarify really what the questions are asking. What do they eat? Snacks and treats. Spend a bit of time with them on that question, because often they will, the longer you spend on it, the more information they'll give you, a little bit like with the weight clinics that I'm sure you've done. Previous chronic health problems, quite self-explanatory. You may have that on history, but if you've got like a second opinion case, then perhaps not. Behavior problems and recent changes in behavior, that's kind of a space for just broadly thinking about that. But then down here, you're noting more changes in things like exercise tolerance and appetite and frequency of urination and such. All those things can fit in with a picture if you're might point you towards an endocrine imbalance, or may point you towards a kind of depression element coming in if it's been a long time skin condition. So, and then worming and what treatment they're wormed with is always something that's relevant to have on file. So then on to page 2, and it starts more into dermatological history. So gathering stuff that's particularly relevant to dermatology. Presenting complaint, this is going to be something that you're filling in more with them. And I should just pause at this point and say, you can use this, and I've designed it to be used either to give to the client for them to fill out, and this does depend a lot on how much time that you have on your hands. If you have a lot of time, then or at least you've got time enough for an hour-long consult or something, then I would suggest doing the questionnaire with them. That's what I would do. I went through the questionnaire with them. You find out much more information. It's a good chance for you to chat to the owner, and if the history is like a tree, then when you do this questionnaire, you're kind of shaking that tree and you're trying to get these little dermatology apples to fall down. The owner, if you give it to the owner to take away, hey, it's better than them not having any history at all, but they tend to come back with very little information filled in on it. So I'll go through it with them. So then when you go through this section with them, you'll be filling in the sorts of lesions and things that you're coming across. And if you're inexperienced with dermatology, don't be intimidated by that. That's something that with CPD, with support, you can start to get the hang of more, and it's really good actually. You start using that muscle and start writing down the sorts of things that you're seeing. Other pets in the household affected with a skin condition and people in the household. I mean, that's obviously getting at contagious and indeed zoonotic diseases. Dermatophytosis, ringworm being a big one there. That's a real pointer towards that. So definitely worth asking. When did the problem start? Sometimes owners can get lost in when it started. They want to tell you it started 3 weeks ago. Actually, the skin problem's been rumbling on for years. They just mean that this current flare started a few weeks ago. So make sure you kind of just basically note down everything they say there, I think is the key. So what was the age of their pet when it started? Can be a good indicator for allergy. Generally allergies start between 2 and 4 years old, so that kind of time period. So you want to, that's why that question's there. What did the skin condition look like at the beginning? Because they can change over time, and it's important to know what it looked like at the beginning. Dermatologists talk a lot about primary lesions, so they're the lesions that were there at the beginning and can be indicative of what the problem actually is, rather than secondary problems that have come on because the skin is unhealthy and not doing well. And that is really what this is getting at as well, noting where on the body did the problem start. And I've put the pictogram on so you can note and circle, or they can note and circle where it was, which will just make it easier when you're then telling your vet where they are. I mean, I'd still practice writing things like ventral abdomen, but yeah, that does make it a lot easier. Has it become progressively worse? That can be a really useful thing to know in dermatology when looking at cases. Has this just kind of stayed the same? Has it even gotten better over time? Sometimes with certain conditions they become more comfortable over time. Then tick if you've noticed your pet doing any of those things. I mean, that's just a really good way of finding out exactly what it is that they're doing, because sometimes owners will not perceive that or you'll ask them, is your pet scratching or is it itchy? And they'll say no, and actually it's rubbing a lot, along the side of the chair leg, or it's licking and chewing, and people don't perceive that as necessarily the dog being itchy. So it's a good way of clarifying that between you and them. Then on to the next page, and was the animal itchy, and if so, has it become more comfortable? That's kind of what I was getting at earlier, so that's an important question to ask. Then this is really, and I always say to owners, this is very relative, and I hated it to be honest, at the beginning. I would often skip it. I wouldn't ask it because I just felt so stupid saying that, with 1 being slightly and 5 being tremendously itchy, how itchy is your animal? And invariably, because they're there seeing you and they're happy to pay some money to get to the bottom of their dog or cat skin problem, they're going to tell you pretty high up on the score. But what's useful about it is asking them again. Once you started a treatment plan and you ask them, is it better? And they say no, which is often the case because the animal isn't cured, it's still scratching. And let's say they'd said 4 or 5 at the beginning, you might say to them, well, on a scale of 1 to 5 now, where would you put them? Oh, they're still itching, there's just 2 to 3, and you think, well, okay, we've actually ascertained that there is an improvement there. So that's why that can be handy. It kind of cuts through the client. Really important question: does the skin condition get worse at a certain time of year? Seasonal when looking, particularly with cats, but yeah, really with dogs as well. Like, seasonality is really important. So that's a big question. And then digestive problems is, aside from just always being a good thing to know, they can be a marker for food sensitivity or intolerance. So yeah, the skin being a reaction to food, that's quite a good thing to know. I did, during my time, pick out 1 food sensitive patient from that question. And then, have you noticed hair loss? And that could be any hair loss from chewing, or just hair loss from it falling out. The important thing is noticing alopecia and noting where it is. And again, it might be you filling that out from your own examination more than them, but it's good to have that recorded. And then just picking up on some hormonal or seasonal things that can cause. Seasonal in terms of female seasons. That's what these are getting at. So always good working through those questions. And then the final page is really just trying to find where they are in terms of their current treatment regime. So this is really important, and I reformatted it. And anything on this questionnaire that you don't like, we can change it. That's the handy thing with having it uploaded on the website. You guys can suggest changes, things you don't like about it, and if there's enough of you that don't like it to justify changing it for everybody, then we can take things out, add things in. It's kind of, I used it as it was, but one thing I always wanted to change, and I did for this, was splitting this down the middle and having treatments that they have already used here, and then you can note over here whether they worked or not. And that's really important, because actually sometimes you can tell what's going on with the skin case and what might be wrong just from what treatments have worked before, but it's not necessarily something that the vet will think or have the chance to do, because it involves looking back across lots of history. So that's really important. And then working out, of course, what current medications they're on, so that your vet's aware of that in terms of choosing the next lot of treatments. And then the biggie, always a biggie, what flea treatment. And this is obviously working out what flea treatment they've used and how often do they use it, and really sort of drill down into how often. If they say monthly, work out, is it actually monthly? Because as we all know, it's very often less frequent than that. And if let's say you've got a cat that's sensitive to fleas, then that's going to be critical. And I always say to owners, it's not an insult to your cleanliness asking you if you've treated your home or car with an anti-insecticide. That's not something that people do, but it's good to know. It's good to have it in your back pocket, was what I always used to say, in case we feel like it might be something that's necessary in the future. And then just going through, trying to ascertain which of these dermatology signs they have seen at any point. So just ticking if they've noted them or not. And that can be really handy. And then you've got a space down the bottom for questions you wish to add. So any other little notes and things that you've picked up on the way. So hopefully that helps you a little bit understand the dermatology questionnaire. Sorry for the delay. I'm glad to get it out to you guys. Do give me a feedback on it like I say, if there's anything that you want to change. And good luck using it with the clients, and I hope it really helps. Thanks everyone.